health has been in the news a lot this week. Health has been in my monologues and in my writing this week. And health is going to be the topic of this segment because it is one of the major stories of the moment, as it always is, but especially now. Joining us now is my friend Sanjeev Sriram, who is also known as Dr. America. He is in his Dr. America outfit now, even as we speak. He has a podcast of that name entitled Dr. America. That's his media personality. And in his civilian life, he also practices pediatrics here in Southeast Washington, D.C., and is an assistant professor of pediatrics at George Washington University School of Medicine. So joining us now, Sanjeev Sriram. Sanjeev, thanks for coming back on the show.
Thanks for having me.
So you've been following what's been going on with the Trump and the Republican health proposal, the one that they're calling, quote unquote, TrumpCare. Thoughts?
Yeah, so it's funny the squabbling that they've had over TrumpCare, RyanCare. I'm calling it trying to care. You can try, but you're not getting no health care with that bill.
Right.
And I think the thing that's been so striking about it has been like just the complete lack of a real American philosophy of let's make healthcare a basic human right. And that is completely missing from this legislation. It's really tough to find what are the health justice values. And I think that it wasn't until I got to the parts of the bill that covered the tax breaks and the bonuses to the insurance companies that I started to really see what this bill was all about. And it's not healthcare, it's wealth care.
Yeah, and absolutely, other people have made that point, or you could call it chump care because you think you're a chump if you think you're going to get health care out of this deal. But yeah, the bonuses to insurance companies that you mentioned is that the Affordable Care Act took away the tax deduction for executive salaries above $500,000 a year. This gives it back to them. The tax breaks, we've talked a lot about how it's really a transfer of money back to the top 1%. Forbes 400 are getting $7 million tax breaks on average, each from this bill. So there's all of that, but to what extent now, here's where I tend to be to the left, let's say, of the Democratic Party as a whole, but I think kind of in line with the American people, because I'm a big believer in Medicare for all. I did health policy, as you know, for a while, and when they were debating the Affordable Care Act, my initial response was, I like a universal health care system, but we don't have political space for it. Now I think it's all we've got left. But I don't know what you're thinking on this.
My thoughts on it are that when you look at the way healthcare was before the Affordable Care Act and where it is now, there's been some growth in peace of mind. That I have a lot of patients, pediatric patients, who I was taking care of for years. They had either grown up with birth defects or maybe they were teenagers with juvenile onset diabetes. And I was seeing them through to usually high school graduation is kind of like a landmark in time for pediatrician and patient. And for a lot of those patients, the peace of mind that they were getting was that their health conditions was not going to be a limiting factor in building a good future for themselves, that they weren't going to be facing discrimination from insurance companies, that they had options for where to get Medicaid. Some of them were going to be able to qualify for sticking on their parents' health insurance. All in all, it was peace of mind that these young people were looking at. And I felt that that was actually the greatest asset that the Affordable Care Act was introducing to our healthcare system, was that it was giving more people peace of mind. Now, there was still a lot of peace of mind that was still not covered. There's still a lot of things about health insurance premiums being unaffordable, which are problematic. But for the amount of good that this law did, I felt that it was giving us that stepping stone to the next things that we could do and build towards universal health care, no matter what it was going to look like. And it feels like this law, TrumpCare, RyanCare, ChumpCare, it's moving all of it backwards in ways that are way before what we had before the ACA.
So you're saying, and that's a take I've only heard from one or two sources and just in passing. So you're saying it doesn't just undo the Affordable Care Act, it makes things worse.
Oh, absolutely.
And I think that's I think you make two great points, Sanjeev, actually. I'll correct that. One is by bringing it back to peace of mind, which I think is terrific. Second is the notion of human stories, which I think is what this all boils down to. And the third, I said two, there are three. But the second one has two parts. That's how I always get out of it. But the third one is the fact that, in fact, it does make things worse. Tell us a little bit about that.
And really, when you look at Medicaid, I mean, that's where that's where this bill does its worst damage, hands down. Absolute worst damage is what it does to Medicaid, because right now we have an open commitment where the federal government funds each state's Medicaid programs as those Medicaid programs kind of shrink and grow as life goes on, whether a state goes through a recession, where there's a natural disaster, or simply people unexpectedly need more Medicaid in their communities. The federal government is there to support that. With this, what this bill does is switch things over to either block grants or per person spending caps, which are awful for keeping that flexibility that Medicaid has in everyday people's life. I mean, I call Medicaid one of our most underappreciated programs. It's a first responder when crises happen, both big and small, for individuals or communities. And the way that this bill is structured, it's wrecking Medicaid's strength in American healthcare.
I think that's exactly right. And I think, in a way, it has a certain equivalence with the way they want to dismantle Medicare, too. In this case, they just say to the states, here's a certain chunk of money, that's all you get. In the way Paul Ryan wants to dismantle Medicare, they say to the individual, here's a certain chunk of money, a voucher worth a certain chunk of money, and that's all you get. But in both cases, the end result is it's about the money.
Right.
It's not about the commitment that a society has to its members, whether they're old, whether they're poor, whether they're ordinary, middle class people who are neither of those things at the moment. It abandons that sense that there's a commitment that if you're struggling, we'll take care of you.
Right. And I mean, I think the thing that, especially when I look at how I like to provide healthcare for my patients, when they get a new diagnosis that is bad news, I really want them to be able to focus on how we are going to move forward together as doctor and patient, that I'm going to be their partner through that journey ahead. And I really want to do everything that we can to restore health, or at least get to a better place than when the diagnosis start. That work is completely undermined if my patient and their family is constantly worrying about, are we going to go bankrupt from this diagnosis? I mean, and that's where I was talking about peace of mind before, where how on earth do you expect a family to focus on the priority of getting better when they're worried about getting bankrupt, which is a legitimate worry.
Oh, it's a very legitimate worry. Look, even with Affordable Care Act, people struggle with the issue of medical bankruptcy. If you have on top of that you don't even have the basic protections that plan was affording, and what struck me, and you're talking about your pediatric patients, is how many children and older people are in the same boat with this bill, because people, for example, let's say 55 to 65 who don't yet qualify for Medicare, and of course it also endangers Medicare, robs Medicare of some funding. But if you're not ready for Medicare, if you're 62 or whatever, and you find yourself suddenly without a job, or need to change jobs, or you could find yourself really out of luck with this bill.
Absolutely. And I think that's what I find. It's interesting how this crisis is actually kind of showing how we are all mutually vulnerable. That you can be at the beginning stages of life where, maybe you've been dealt a rough hand just right at the get-go with a birth defect or some issues going on in your health, or you are just going through normal aging. And things happen after you turn 50, where risk factors come up, questions and concerns come up. And all of what binds all of those concerns together, whether it's a newborn or somebody in their 50s, who, like you were talking about, what binds all that together is that they should be able to get to a healthcare provider and have the conversations that they need to have about, okay, what is optimal health going to look like for me? And instead, we're having a lot more concerns and questions about, am I going to go bankrupt from having that conversation?
Right, because you as a physician, and again, we're talking with Sanjeev Sriram, also known as Dr. America, because you as a physician, you need to know you can't provide proper care if you write a prescription and they can't fill
Right.
it.
Right.
Or if you suggest a diagnostic procedure of some kind, whether it's an MRI or CAT
Right.
scan or whatever, blood test, and they can't afford that.
Right.
So the work of doctor and patient both is impeded in that case. So, one of the things that the right used to attack the Affordable Care Act was when President Obama said, if you like your health plan, you can keep it.
Yeah.
Remember that?
Yeah.
The notion of choice. And there were cases where, because of inadequacies in the design, people did have to change plans.
Right.
But the notion, even more fundamental than that, I don't think people are as attached to the insurance relationship as they are to the doctor relationship.
Right.
So what does this do to the doctor-patient relationship?
So you mean the new
The
legislation?
new, were
So
it to come to being,
The
were it
new
to be passed.
legislation, I think that the more that my patients have to worry about can they afford to come and see me, that's going to undermine our ability to work together and get their health back on track. And I feel like for the patients who do decide to bite the financial bullet and schedule those appointments and see their doctor, their health is still going to be undermined because they're not going to have the money that they need for nutritious groceries, for paying the rent, for keeping the heat on. And those are all things that impact health as well. So our patients are facing these false choices of, are they going to keep their wealth? Are they going to keep their health? If they decide to keep their health, how much more of their wealth are they going to be sacrificing? And that's, I think, when I look at the specter of what this bill is posing, it's just a nonstop range of false choices where the American people can't win.
Right. And as you know from your public health work, health and wealth are deeply interrelated anyway.
Yeah.
If you rob people of their wealth in order to preserve their health, eventually their health will suffer
Right,
too.
absolutely.
So if you, since you are a great example to me of a physician who understands the holistic nature of the doctor-patient relationship, that you're dealing with the whole person. So what do you tell families or patients that are frightened about what this bill could do to their future? What do you do to try to give them some reassurance? And two-part question. And second, and what would you suggest that, for example, Democratic politicians tell those kinds of politicians?
Yeah, so I think to address the families, I usually, if they live in DC, I tell them that, we have a great team of social workers at our clinic. I mean, these are the folks who know the nitty gritty of how to stay qualified for Medicaid, who to call, how to verify your status, and to really fight back when the part of Medicaid that is privatized to an insurance company, how to fight back against unnecessary charges. So we have some very experienced people at my clinic and a lot of clinics like mine where doctors and social workers team up and we fight back for the sake of our patients. And so we do ask our patients just to let us know. And so then we join their fight. And for the broader political fight that patients and families can do, it's really to get in touch with your members of Congress, going to those district offices, calling them up. And even when you suspect that your member of Congress is a Democrat or a progressive or a moderate, and they seem to be pretty friendly towards the Affordable Care Act, I say leave them a message anyway.
Right.
Let them know that it's great that they have that kind of support, but especially for things like Medicaid, which is always kind of the tough program for moderate Democrats to really rally for, it's to remind these members of Congress that this program is a part of every single American's health. There's none of us who get by without the help of Medicaid.
Right. And explain what you mean by that.
So, the thing about Medicaid is that it's such a broad program. We're covering 70 million Americans through Medicaid. And even if you are not one of those 70 million people, the thing is Medicaid is actually part of every hospital contract. So the hospital that you know and love, the one that has all the great doctors that you really like, the nurses who do an excellent job, that hospital, in order to keep lights on, in order to expand, in order to keep hiring people, train people, they have a Medicaid contract. And part of the strings attached to that Medicaid contract is that their doctors are well trained, is that their equipment is up to date, that everybody is using best practices, that they have strong networks. So Medicaid is actually doing a great job at keeping quality care happening in our hospitals. And that's regardless of whether you're enrolled in Medicaid for your coverage or not. You're benefiting from Medicaid doing that work. And from a public health standpoint, when Zika was
Right.
threatening the southeastern United States, Medicaid had an action plan ready to go. If you're in a community where the opioid crisis is hitting really hard, Medicaid is the best weapon that we have in the fight against opioids. It's the largest mental health and substance abuse provider in the country. So for all of these different fights, Medicaid is there. It's a great first responder, and it's doing all of this work regardless of whether you are in the program or not. So that's what I mean when I say that Medicaid is affecting every single American.
Yeah, I think that's a terrific explanation. And I think that going back to your original point, I think the other message that people on the left, people in the Democratic Party need to be giving, and moderate Democrats have to fall in line with, is healthcare is a human right.
Absolutely.
And we will fight for that.
Absolutely.
So Sanjeev Sriram, physician, pediatrician, and host of the Dr. America podcast. Thanks for coming on the program.
Thanks for having me.